But what I want to bring out today is the fact that you are vulnerable. You are in a high-stress, demand industry, and you can work literally 7 days a week, all the time. And that's not good work-life balance. You cannot sleep because you think you got to study. But if you don't sleep, then you don't do very well because your prefrontal cortex is shutting down because you're in the amygdala and your body is in a survival mode. So that doesn't allow your body to retain that information. So ultimately what I want to be able to do is kind of share with you some vast experiences that I've had, how heart rate variability has helped me as a clinician, and the times when I didn't have it, and share with you that information because it's kind of interesting and funny all at the same time. Everything is about balance. So everything is a cause and effect. Our body is made to be very parasympathetic, not in the sympathetic dominance that we deal with on a daily basis. This allows you to retrain that, and we'll dive into that a little bit more. But it's very, very important of why heart rate variability is important for you as physicians. And I'll give you an example. A high-stress environment. So here I am. I'm in my 3rd year of residency. I'm chief resident. I would say I had a level of arrogance when it came to circumcisions because I had them done in 8 minutes. Where everybody else, it was 45 minutes to an hour. It was going on, and I had done probably 30 of them. And so no one wanted to deal with this mom and dad because mom and dad were very much hoverers. And I was like, oh, no problem. I got this. I'll walk in there, get this done. I'll be out in like 8 minutes. Not a problem, right? So literally, mom and dad, you're not going to cut my kid's penis off, are you? No, that is not the intent. And no, we won't be doing that. And well, are you going to numb them up? How are they going to feel the pain? So just grilling me with questions, right? Well, how many have you done? Okay, well, we're going to go in there and watch you. Never had a parent come in there and watch me. Not just one, but both. Right here. I'm right here. Right? So, as I'm doing this circumcision, things start off pretty good. And then all of a sudden, as I clamp down, and then I indent the skin, and I start to cut right in between where the blood is pushed out, my hands start shaking just a little bit. And when I snipped the foreskin, I went out of my area where, so you create a crease and cut off the blood supply so there's no blood, right? So my scissors went over just the hair, enough to create bleeding. Well, now it started to affect my visual field. So now I'm like, crap, now I can't even really see. So now I'm trying to dab with gauze as I'm trying to use the utensil. And the parents are like, is that okay? Is that normal? Is that normal? What's going on? And all of a sudden my hands start going like this. I mean, you want to talk about having Parkinson's, it was insane. I literally was having that. Now my father has Parkinson's as well. I did not have it in that moment, but it was one of those things like my nervous system, my sympathetic dominance had kicked in because they're grilling me with these questions. I didn't have SMR, which I'm in a sensory motor rhythm where I'm alert but yet calm. Internally, my heart's beating, my blood pressure goes up, my muscles are tensing up. Why? Because I had fear that I was going to disappoint the parents and I wasn't able to see, and I literally end up tapping out. Here I am like the guru of doing circumcisions in the office or in the residency program, and I fumble it completely because I didn't have this training. By nature, my brain is constantly working. Why? Because I have many rabbits. How many rabbits can you catch at one time? One, right? So in my brain, I have many rabbits running around. I try to go catch a bunch of them, and sometimes I will go off path, but I try to stay focused on one of them. Now I'm able to stay focused on one of them, but I'm chasing it around. And that's because now I'm in a state of being able to retrain my body with SMR. But when in heart rate variability, you know, my engine underneath, my RPMs are really, really high. I come home, I'm a high energy guy at baseline, so I'm always ready to go. But nonetheless, this is one of the things that allowed me to create that calmness and get more grounded and more focused. So when there are times when you are able to deal with situations that you're in a room and you have a family member sitting there, the daughter, and the mom has liver failure, have esophageal varices, and all of a sudden she ruptures. And she literally projectile vomits across the room, blood. And then she codes with the daughter. Right? How do you run that code? You have to be calm. You have to be there. And this is where this training comes in. And it's not just for that. It's for when you're kids, if you have a relationship and you decide to have kids. You have to be able to control yourself when you get home and not take your work with you. You have to compartmentalize. Because in that moment that I had with that person and ran the code, I went across to the North Building to go deliver a baby. Someone's most precious moments of someone's life as a family for people bringing in their first newborn. So can I take that crap with me? No. And I can't go in there and just be like in a state of panic. You have to be able to calm yourself. So I was able to compartmentalize, but my compartmentalization was just blocking things and shoving it in the drawer, wasn't allowing me to deal with it. This training allows you to deal with that. It gives you emotional regulation. Instead of sticking into your amygdala and your fight or flight response and staying there all the time, you are able to get into your rest and digest and relaxation mode, allowing your prefrontal cortex to work better. So let's start at the beginning. When a battery runs out of charge, we say it is. When a human body runs out of energy, it is dead. Our energy currency in our body is ATP. So taking that concept, and let's just take the battery analogy, let's start with the beginning. Would you all agree with me that the law of thermodynamics and that energy is nor created nor destroyed, it only changes form, correct? Is light a form of energy? Yes. Interesting. Anybody know what this is? Close. This is the moment of conception when the sperm hits the egg. You get the zinc spark, and then the zinc spark kicks in, and you get a flash of light that depolarizes across the cell membrane with calcium ions and phosphorus ions moving through, creating this flash of light. And that moment, you start to become the self-healing, self-regulating system that becomes what you are today. I always tell my kids they're my favorite gametes, but that's only for nerdy people. Anyways, look at that. This is you as an individual. And now you're an individual, and each of you have a special purpose. There's never going to be another you. But you're an individual. I find it interesting that in John 1:9 it says, that was the true light which lighteth every man that cometh into the world. So when does life begin? At that moment, because we just all said that lack of energy is death, and light is a form of energy, and that happens at the moment of conception. So one disease may be caused by many factors, and one factor may cause many diseases. This is why there's so much discontentness going back and forth in medicine and the research articles, because we're trying to find a reductionistic standpoint of look at one thing and think that that one thing is going to fix everything. We try to look at research studies and think we're only going to affect one pathway and it's not going to touch anything else when everything is interconnected. It's not going to work. You have to look at the whole body on a physical, chemical, emotional level, because we have our environment. Our nervous system senses our environment. So you have toxic chemical exposures, things you put on your skin, the things that we breathe, the food that we eat, or the foods that we eat that are man-made foods that don't have the nutrition in there. You got stress, negative emotions that come with it. I got a poor grade on my test, whatever. You got those stressors. You throw in there lack of exercise and lack of movement. Our body is made to move. If you don't move, it's going to decay. It's principles of how our body is supposed to work on a physical, chemical, emotional level. Then you got drugs and alcohol because people are trying to give themselves stimulants and do different things so they can perform better, so they can get their body to be really focused instead of getting their body into a state of SMR through breathing. Trauma. You got your traumas and your injuries. You got smoking. You got radiation. All of that affects our body. They're going to come in there and they're going to bombard the body. And each person is a biochemical individual that is going to affect the body all the way around. And you may have all of these, you may have one of these, but they're going to lead to decreased poor energy, decreased detoxification pathways. It's going to increase hormone imbalances, GI problems, structural stresses, GI problems. Let's just take anxiety and how many people have nausea with that. How many people have constipation that are anxious? A lot of them. Why? Because when you're in a sympathetic dominant state, if you're getting chased by a bear, are you going to stop to take a crap in the woods? No. Right? Because you're going to be that bear's meal and it's going to defecate you out. Right? You don't want to do that. So it doesn't even make sense. It's physiology. So, and then it creates this chronic inflammatory response. Now, inflammation, they talk about inflammation is the cause of chronic disease. Inflammation is not the cause of anything. Inflammation is the effect. What's causing the inflammation? So let's work more upstream and fix the dam instead of sandbagging each house. Right? That's the point. But you have to find out where is the person in there, and you can't do that in a 10-minute appointment. But sometimes you're triaging and you're playing fireman. But just because the fireman is the first one that shows up to the fire doesn't mean the one he caused it. Hence cholesterol. But different time. Nonetheless, so all that affects your cells because we're made up of 100 trillion cells plus. And all those make up our body. And they make up our systems and our organs. And it all affects all the way down at the level of the cell. So what can be measured, can be monitored, can be managed. You don't know what you don't know. Don't assume. Test. Don't guess. So when it comes to heart rate variability, it's that R to R interval. So in your QRS complex, right? That's what it is, measured in milliseconds. So we're looking at it, and you're looking like, oh, does this person have an arrhythmia? Is there AFib? Is there a PVC going on? You're looking at the QRS. Are they even? And you kind of map it out, and testing and seeing, but you're not going to notice that variation in those milliseconds. But HRV is not nearly about as much as that distance between the R and R as it is about the adaptability and the ability of your body to be able to calm itself in a stressful environment. When you do that, you move your diaphragm down. When you move your diaphragm down and the lungs move out, what happens to the intrathoracic pressure? Increase or decrease? It decreases. If you decrease the intrathoracic pressure, the air pressure up here moves into the lungs, and the lungs start to expand. When that happens, does that increase or decrease your preload into your heart? You're increasing your preload, which is hence the respiratory gallop, because now you increase the blood supply into your heart. When you take that diaphragmatic breath, you're also stimulating your vagus nerves, because there are two of them. Everybody always says vagus nerve, but there are two of them on each side, on the posterior columns right by the spinal cord. But then when the lungs come in, it will touch those, and when the lungs expand, and also they'll get stretch receptors through the diaphragm that causes that depolarization to go up. Now, if you're B12 deficient, that might affect myelin sheath and things like that. It affects your odd chain fatty acid metabolism. Anybody remember the spinal tract that is affected with B12 deficiency? Decreases vibration sense of proprioception. It's on the back side. DCML, yeah, dorsal-column-medial lemniscus. Yeah, so that's something that you could pick up on. You know, the tuning fork test is just not a tuning fork test. You're looking to see, and you're looking at physiology. But now I'm chasing a rabbit, and I won't do that because that's a whole other lecture. But nonetheless, you can see how our body is made to run off of what? Vitamins, minerals, proteins, fats, carbohydrates, water, and oxygen. If you don't have oxygen, you're going to die. You can not eat a long time and not die. You can get dehydrated, they're all things, but you're going to die pretty quickly without oxygen. We need it because we need to make our ATP. So if you have low HRV, you're in a chronic stress state, creating fatigue, impairing your focus, and emotional dysregulation. How many of you have been asked by someone in front of your peers a question and you become a deer in headlights? Because you're standing there and that pit in your stomach kicks in and the heart rate goes up and you're in that moment and your prefrontal cortex shuts down where all your information and logic is, and you throw out some dumb answer that doesn't even make sense. Like, how did he hurt his shoulder? I don't know, his sheets were too tight in the bed? That doesn't make sense, right? So, why does that happen? Because you're not trained. You're already in a stressful state, and so your prefrontal cortex shuts down, your amygdala kicks over, you go into this fight or flight response. But if you're already there and you're always chest breathing, people are like, oh, I carry my stress in my shoulders. Why is that? Because they're using their accessory muscles to breathe all the time because they're not getting their diaphragmatic breath. So everybody stand up really quick. Come on, we're going to do jumping jacks, just joking. All right, slump over like you're a depressed person, lacking energy. All right, slump really good. Now take a big deep breath in through your chest. All right, there you go. You get your tidal volume. Now stand up, upright, put your palms out like this, put your head back, and now take a big diaphragmatic breath through your belly, let it out. You feel how much more air you get? Function follows structure. So people that are depressed, are they upright like Tigger and bouncing around? No, he's in a state of mania. But what about Eeyore? Eeyore's like this, oh poo, my tail fell off again. It's a low energy state in the brain. That's what depression really is. And how do we work that? You can work that with doing this because you rewire the brain. You can all sit down now. Your brain takes 20% of your ATP at any given moment. That's phenomenal. But if you have decreased oxygenation, you have decreased blood flow, you got bad neural patterns because you're constantly in this fight or flight response, it's going to accumulate and you're going to wire that in your body. No different than you're going to train in something and wire this because I want to be the master at this technique and doing surgery. Just like I was with the circumcision. But you can see how not being in a calm state fumbles that a little bit for you. So again, this gives you better mental flexibility when you're doing this heart rate variability and breathing. So what I learned for myself is that I'm too busy not to do this, to take the time to allow my body to start to get that calm response, to be able to shift very quickly. No different than an NFL quarterback that is in his prime and really, really good, where they basically walk up and then boom, it's game on. How do you walk into a room, run a code, and then go deliver a baby? It's game on. But you have to be able to shift and not waste your energy being in this constant stress state, and then you hyperventilate, and then you go into an anxiety attack because it's this feed-forward process. So you have to be able to control yourself. You have better, faster reaction time. You have better neurological control. There's a whole thing with this regarding athletes. But it's more about you in these high-pressure environments and how you can stay calm. So don't waste the opportunity that you have right now to be able to train in this and help your body to be able to stay calm so you can perform at your peak. And if you don't rest, when you don't rest and you don't sleep and you're starting to, you're not getting your deep sleep, you're not getting your lymphatics when you're going into REM, it cleans out all the junk in your brain so that your body can repair. It's going to accumulate over time, people. It's going to accumulate over time. People say you are what you eat, but you also what you don't eliminate. And we have many different ways to eliminate things beyond defecation. So again, you want to have better hand-eye coordination. You want to be able to be a better communicator with patients. You want to be able to be compassionate, be there in the moment with them, no matter what you got going out in the outside world. I've had many patients that will tell me that they didn't like so-and-so, and I was like, you never know. You never walked in someone's footsteps. Maybe that doctor had a real bad day. Maybe his mom just died and he has to still see people. Whatever it is, you don't know. You give people grace. That's what we're asked, is grace upon grace upon grace. So give that to people, but listen and care. Be compassionate. Put your ego aside. But train, because there's 76% of medical students that experience some sort of burnout. Physicians, I did it. I was ready to quit with 6 months, right? I almost did it in residency at the very end as well. At that point, I was a licensed physician. I just would have been a general license, nonetheless. Again, because I didn't have this training. And I had a good way of compensating and compartmentalizing, but that's not the way to go, because then you're always burning hot under the engine. You're good on the outside, but you're dying on the inside. And so you got to think about those things. You got to care for yourself on a physical, chemical, emotional level to build your resilience, because we all have a threshold. You're right here, and let's say our cell's negative 70 millivolts on average. If I punch you in the arm, you get tissue damage, it's going to be negative 20. It's more positive. That's more of a stress response. But we need to remove these stressors. So if you're here, and it's only going to take one thing to set you off, where you might say something that is unkind, something that you typically would not do, wish you had that moment back when you get back into this relaxed state, because you went into a fight or flight response. So how do we change that delta? We remove the physical stressors. We remove the chemical stressors. We remove the emotional stressors. And now you're here and you have more of a delta before you hit that threshold for that action potential for your body to become something that you typically would not. And this is what it does when you're training. It's important for critical care. It's important for surgery. It's going to be important for you on your rounds. So train right now. Do the things that you need to do to help your body heal. The HRV is giving you real-time feedback. Again, you can't monitor what you don't measure, and you can't manage what you don't measure either. And again, you don't know what you don't know. If you have not done this, increase your cognitive resiliency. Increase your heart rate variability, decreasing your overall heart rate and your body's ability to respond to stress and calm it, because your stress isn't going away. I've thought of a patient probably 3 different times already in talking of people that I'm working with right now and concerned about. It doesn't leave you. All right? It's always going to be there in the back burner. But how do you control that? Be there for your kid's birthday party. Be there with your spouse when you're on a date. So it comes with training, no different. So key takeaways, HRV training. It makes better doctors. It allows you to focus, make better decision making in the moments. When you're running a code, you have to be able to do that. It's a stressful environment, very high stress. You have to organize people, tell people where to go. You have to be a leader. Leaders have to step up their game. They have to raise the bar. They have to raise their standard. And it's not just about studying to pass a test. It's studying to save a life. You may not use some of this information for 20 years, but it's going to come up at some point, and you got to be resourceful. And we got tons of resources now, and we have them at the drop of our hand. Being resourceful, how to now clinically apply that information in times of stress and putting it out. But you're not going to be able to do that if you're shaking and fumbling and trying to find something and resource it. You've got to get yourself in a better state. You've got to train yourself like a professional athlete does. So physicians with high HRV, they have less burnout, they have stronger patient connections, and peak cognitive function. That's facts. Those are things in the research. You can look them up. The burnout is real. Don't let it be you. Don't be a stat. And if it is, talk to somebody. I had good mentors that talked to me. It's like, what do you need? Nothing. They let me talk. They let me listen, or they just listened to me. I was able to share, get it off. When I did that, I felt heard. I felt, justified in what I was feeling, but I didn't stay there. And that's key. So wherever you are in this journey, always reach out. You're never alone. And medical students should start HRV biofeedback now to optimize your performance in the future so you don't fumble along on a circumcision like I did. So with that, I want you to stay curious, stay a beginner, and you're not too busy to do it. You're too busy not to do it. You have to do this, in my opinion. I hope you learned one thing, whatever that was today, that it was worth your time, and I thank you for being here. Thank you, and God bless.